insecurity and conflict, a prison director called us and asked us for his assistance. In his prison, he had a serious problem of health and mortality for the detainees in his facility. Inmates were becoming very restless, the families of inmates were becoming very restless, the staff were becoming very worried, and it was already becoming known in the community. We called in health in detention experts. We have a specialist set of doctors who work on this globally, and we could quickly diagnose a simple problem related to nutritional issues. In 3 days, the whole prison population was screened and treated. 250 people out of 400 who were exposed to that risk were treated, but 11 people had already died. After the joint intervention, the authorities together with us, there were no further casualties. That story is a little bit more dramatic than many that we are exposed to here, thankfully. But I think some of the lessons we learned there, the things that I learned from that, are useful for all of us. The very first point was the commitment of the authorities themselves. They were the responsible partners who saw the issues and who decided to have them addressed. And I think that is the essential component of any progress in any detention system. Secondly, it was clear that the duty of care faced by the authorities in the cases of detained people is extremely heavy, because the population no longer has any capacity or freedom to take care of their own problems. That duty of care needs to replace all of the mechanisms that exist in the community and at the same level that the community is able to deliver them. Prisons are not isolated from the wider community, neither in terms of their reputation, neither in terms of health, nor in terms, as we saw, in terms of rehabilitation programs and all the other linkages which are needed. Interventions, however, and I was pleased to see the example from New Zealand, my home country, but also we've seen it in many countries around the world, intervention can be very cost efficient and very time efficient. They support security concerns, they support image and public relation concerns, they support rehabilitation program concerns. Interventions need to be looked at as sound investments that pay back, not as budget burdens. And there must be a preventive system in place, including qualified and independent experts. In the case of health in detention, which is what I want to talk about, they need to be independent doctors and there need to be medical services available at all times. Those are the understandings I got from that experience, and those are the spirit with which I come today. In our experience, in times of peace, just as much as in times of war, the investment to ensure healthy prisons are not just an obligation as soon as somebody is deprived of their liberty. They are not just a question of image and reputation. They are critical to the overall function, security and purpose of detaining people. If inmates and staff are to be safe and secure and to contribute to a better community at large, attention to the health and dignity of all, both staff and detainees, is crucial. This is also, of course, a national public health issue in every country. Detainees come from and they return back to the community. Staff and visitors ensure the transmission of well-being or ill health every day. Disease, unfortunately, moves freely beyond prison walls. Key epidemics, TB, we had just a discussion here, I can only support the positions taken by Madam Chair. HIV or other transmissible diseases, these cannot be controlled nationally without controlling them in prisons. Detention facilities are unfortunately a very fertile breeding ground for a variety of such diseases. ICRC looks at prison management holistically. We adopt a multidisciplinary approach. We try to assess and support the best practices that the authorities are looking at. We have 70 dedicated doctors and nurses working on this around the world as we speak, and a specialised unit in Geneva developing our policy and supervision for this.